Trump's new Megabill.
Discover the long-term effects on Medicaid, taxes, and more. President Donald Trump, along with congressional Republicans, has initiated a monumental bill concerning tax and spending. This expansive legislation is set to affect millions across the nation, especially those in vulnerable situations. However, the real impact of the bill may not be apparent immediately. Here's what you need to know about this legislation's timeline. Medicaid. Despite Trump's campaign promises to safeguard Medicaid, the healthcare program for low-income and elderly Americans is significantly impacted in this bill. A notable provision introduces an 80-hour monthly work requirement for able-bodied Medicaid recipients aged 19 to 64 without dependents. These recipients must engage in work or approved activities like volunteering. Parents or guardians of children under 14 and individuals with disabilities are exempt from these requirements, and these changes will take effect in 2026. Experts suggest that while the subset of non-working Medicaid recipients is relatively small, a substantial number could lose coverage due to the demanding paperwork required to continually verify employment status. Additionally, changes to provider taxes, which impact healthcare organizations and state Medicaid funding, are expected to leave rural health centers especially vulnerable. Some health centers keep relying heavily on Medicaid may face closure. The Congressional Budget Office forecasts a staggering $1 trillion cut in Medicaid spending, which could add nearly 12 million more uninsured people by 2034. In response, the Senate added a $50 billion fund for rural hospitals, aiming to mitigate the effects of these Medicaid cuts. However, how these funds will be allocated and whether it will sufficiently cover the shortfall remains uncertain. Affordable Care Act. Proposed changes to the Affordable Care Act, slated for 2026, might lead to millions losing their health coverage. Under this bill, streamlining automatic renewals and imposing more paperwork on open market insurance applicants could increase the uninsured rate to roughly 17 million. Food assistance programs. The bill also modifies work requirements for individuals enrolled in the Supplemental Nutrition Assistance Program, SNAP, raising the age for work requirement from 54 to 64 and including parents with children older than 6. Parents with dependent children at home, no matter their age, are exempt. These modifications come into effect as early as this year. Additionally, states will be required to cover at least 5% of SNAP costs starting in 2028, whereas currently, the program is entirely federally financed. A projected $230 billion cut over 10 years is anticipated for SNAP. Tax changes. Some tax modifications will be enacted this year and reflected in 2026 tax filings. Tax deductions for tips and overtime pay will be capped at $25,000 and $12,500, respectively. Single filers' standard deductions will rise by $750 and married couples filing jointly by $1,500. The revision to the state and local taxes, SALT deduction, will allow taxpayers to itemize up to $40,000 in state and local taxes, starting in 2025 and growing by 1% annually until 2029. By 2030, the cap goes back to $10,000. The introduction of tax credits for electric vehicles ends on September 30th, and credits for green home upgrades, such as solar energy installations, will be discontinued at the end of the year. Business tax incentives for environmental projects will also expire next year. What do you think about the long-term impacts of these legislative changes? Do you believe the proposed support for rural hospitals will be enough to counteract Medicaid shortfalls? Share your thoughts and let's discuss.